You sit down at the waiting room of your dentist's place, nervously waiting to get your tooth extracted. You hear that they will be administering something called laughing gas, but you have no idea what that is. You quickly get your phone and press play to the first video you see. A gas that makes you laugh, laughing gas. Laughing gas, aka nitrous oxide, is known for the feelings of giddiness it causes. Nitrous oxide became popularized when Horace Wells, a dentist, extracted his own teeth while inhaling N2O. Today, this anesthetic agent is still widely utilized in other medical and dental practices. When administered to the patient, nitrous oxide is able to inhibit pain receptors in the brain, but the mechanisms of action are not entirely understood. There are, however, hypothesized pathways for the two different types of effects nitrous oxide produces. The first is the analgesic effect, also known as pain relief. The effect becomes initiated as opioid peptides, known to lessen pain, become released and activate opioid receptors. The way nitrous oxide initiates this process is still unfortunately unknown, but we do know that when N2O gets to the brain, it reaches a neuron. The neuron will receive a message, and when the message reaches the end of the neuron will release molecules held in vesicles into the gap, the synaptic cleft, between the sending neuron itself and the next neuron. In this case, the molecules held in the vesicles are opioid peptides called dynorphins, or DYN for short. To release these molecules, the sending neuron takes in an amino acid and converts it to nitric oxide, which appears to be involved in the release of the opioid peptides. After the release, the dynorphins will then cross the synaptic gap and bind to the opioid receptors on the receiving neuron so that it blocks pain messages sent from the body to the brain. The second is the anesthetic effect, which causes the loss of sensation. It occurs when nitrous oxide acts as a non-competitive inhibitor for NMDA receptors that are part of the neuron. NMDA receptors are ligand-gated ion channels, which means that you need a chemical messenger, glutamate and glycine in this case, to attach to points on the receptor for the gates of the channel to open up. Once the gates open up, calcium ions will flow in and a message will be passed to the next neuron. Since there are different sites on the receptor, if N2O is present, it can somehow affect one site and change the shape of the receptor so that the original messenger that actually opens up the channel no longer can. The reason why this is so important is because NMDA receptors are known to be associated with higher sensitivity to pain. So by N2O swooping in and inhibiting this channel, it actually causes loss of sensation. You quickly exit the video when they call you into the room. You think to yourself, laughing gas is no joke, and become ready for that operation.